welcome to the ASMR Center for Physical Therapy. My name is Dr. Jimbro, and I will be walking you through today your physical therapy session. As this is your first session with us, there are numerous things that we need to get acquainted with you on. The number one thing is we need to kind of hear about what exactly is your main pain, what's going on, and overall just what is causing you harm today. Hearing a little bit about how that happened, how you believe this kind of came about is also very beneficial to treating you, because obviously we don't want to make any sudden changes, movements, or anything like that that would further aggravate you. But we do want to make sure that you're moving, you're able to get better and overall feel better too. So let's first start off. Can I have your full name and date of birth? Yes, perfect, thank you. Now that we have this information, and I do see I'm able to pull up your chart here, I'd just like to hear from your point of view, like what's been hurting, what is this injury preventing you from doing? Can you move? Can you not move? Is it, what kind of pain is it? Kind of information along that line, so I can kind of better treat you or address a treatment plan that fits your specific needs here. Yes, back pain is probably one of the growing number of pains that we see associated over here, especially individuals sitting, standing, even occurring from an accident. Did your back pain originate from an accident? So you were in a car accident several years ago. With it not being within the last few months, I don't believe that may be the stem of your issue, but there may be some long-term side effects that you're just now starting to see. So we'll kind of get you moving, see what happens here, and we'll kind of develop a treatment plan to get your muscles moving, hopefully a little bit more, maybe not the way they were before, maybe they atrophied, maybe your bones or something is going on there. So we just need to figure out what's the best plan of action here. Now that we have the story, I'm going to ask you to move about, you said that it's kind of right up in here, kind of your right by your neck, and then it goes down and radiates through your back. Is that correct? Okay, perfect. Well, not perfect, but at least we're on the same page right now. So I'm going to be showing you a few different ways that I'm going to be moving here, and I want you to kind of tell me how much pain you're receiving when you move, and if this is more or less movement than you're used to be doing, and where that regular day-to-day pain is. Okay, so the first one I want you to do is simply just look to your left like that, and then come back. Exactly like that. What level of pain is that? And is it primarily your left side that you said that was going to have that? Oh, yep. Gotcha. Okay, so it is the left side. What happens if you do the same thing but to the right and then come back? Okay, so that is less pain. Would you say, if you rated it between 0 and 10, 0 is no pain, 10 is the worst pain in your life, which side would you rate to be the worst? The left? Okay. And what would that be? 7? Okay. Okay. Let me put some of this stuff in your chart here. Okay. Okay. Next thing we're going to do is a rotating part of your neck. So what you're going to do is you're going to kind of look up, and then you're going to come down and around like that, and then look up and coming down around like that. Perfect. Perfect. So now, based on what we did there and what we did prior, how would you rate the pain? Is it the left side which is bad still, or is it the right side which is bad still? Left again. Okay. So everything seems to be coming along this way, which we expected, because that's where you said you've been feeling pain. And again, on the left side, which you said was the worst, on the 0 to 10 scale, where's that? 6? Okay. 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 Now next, I want you to raise both your hands up like this, and then slowly bring them down. Not too quickly. We want to make sure that it's a slow and gradual part there. Okay. Yeah. 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 There you go. So, again, left or right arm there. Which created more pain for you? So still the left, and yeah. How on the scale again from 0 to 10? An 8. Okay. So maybe it's something with moving this whole upper shoulder area, which is kind of getting you some pain. Next, I'd like you to kind of lay down on the table here, and I'm gonna apply some pressure. Yeah, face down, sorry. I'm gonna apply some pressure around some different areas of your shoulder there, and just kind of want to understand what's going on, what you're feeling, and kind of give me some feedback on where I'm pushing and what it feels like. Okay? Okay. Okay. Okay, right there. Ooh, yeah, kind of feeling a knot there. So that might be your center of pain right there. That is your receptor coming out of near your spinal column there. There's kind of a good chunk of nerves there that probably is what's going on here, and just feeling a little bit of, hopefully, some inflammation. I'm gonna grab a little bit of cream here, and then I'm just gonna try and rub it out a little bit, and then we're gonna try and move around just a little bit. Okay, here we go. It's feeling better? That's good. Good. Yeah. Always kind of getting this pressure and relieving some of the tension you're feeling in your back is always a good, very good feeling. I always like to have some of the people here work on me after a tough day. Okay. I'm just gonna put some thumb pressure going on right where you're feeling the bulk of the pain there, right in that kind of patchy area around your shoulder. Yeah, you got a few knots here going on, which you get them. You just kind of, hopefully throughout this whole process, we'll teach you some exercises that'll help reduce that too, and that'll kind of help your overall back feeling too. So, are you working today? Yeah, Friday. Yeah, I'm looking forward to the weekend too. Got any plans? Yeah? Oh, nice. Yeah. Yeah, I mean, summer is pretty much over now. Gotta take the most of what we got. Winter is gonna come too quickly. Alright. Now this next part may hurt a little bit, but what I'm going to ask you to do is put your arms straight out, and then I'm going to just kind of massage the shoulder, and I'm going to ask you to kind of move it back and around while I'm doing so. So start going, and now start moving your hands down towards your feet. Oh, yeah, that's gonna, it's good pain though, right? Yeah. Yeah, alright. Now let's move your hands back up towards your head again. And drop them again. And again, back up to the head. Perfect, perfect. Alright, and down again. Perfect. Alright. Going to do the same thing, but now shrug your shoulders instead of moving your arms. Alright. Shrug. Keep shrugging. Slowly but surely. And down. Up and down. Up and down, up and down. Yeah, I know. You're gonna feel much better after this though. Alright, one more. Up and down. There we go. Perfect. Now let's do some of the same things we were doing before. Can you do me a favor and do the left and then the right? Excuse me. Now, do you feel a little looser? Do you feel like there's less pain? Or is it about the same? It's a little bit less? That's good, good. Now let's kind of do the arm and then slowly bring it down. Okay. No. Just slowly release it like that. Okay. Now do it on your own. Perfect. There you go. Okay. And yeah, that was one earlier that you said that was a little bit harder on yourself, and it kind of brought a little more pressure back up towards the neck. Still doing that, but it's slightly less. Yeah, you said it was an 8 last time? Oh, that's good. Yeah, this is good progress so far, even on your first day. So, next time you come in, we'll kind of have a little more massage. We'll probably do a little bit deeper massage, and then we'll have you do a little more exercises. We have a couple of these foam rollers too. We like these because you can kind of go on and you can kind of work out some of those knots you have. They're great to just apply a little pressure, and you can kind of roll your back on it a little bit, and it kind of releases a little bit of lumbar sprain too if you have a desk job. Oh, you do? Yeah, that'll help then too. And then how's sitting in your car? Long journeys? Yeah. Yeah, that's normally what happens, is people just kind of sit and remain still while they're driving, and they just kind of move their arms and all that, and that actually kind of sitting in one spot is not good. Our bodies were not meant for that. So something, you can kind of get something foam, probably a little softer than this foam roller that I have, but they sell little cylinder things like this in the shape, and they actually hug around your car seat, so you can put that right along the lumbar spot, and then every half hour or so move it up and then down and then up and down, and that'll actually let parts of your back relax and the other parts kind of tense up. Well, not tense up, but work a little bit harder there. So it'll kind of help give a little bit of release for yourself there. But yeah, on our next appointment we'll have a little exercises to go through. We'll probably have some weights. We'll probably have you get on one of those giant balls we have over there and kind of roll around with some of the weights and check some of your balance out and see if moving around in different angles kind of aggravates things a little bit more. We kind of have some other weights where we can apply a little pressure and just overall get you a little bit moving. We'll also have a little homework for you to do too, and we'll get into all that on the next appointment with more things. But any questions for me before we kind of dismiss till our next appointment? Okay, great. Yeah. The massage is probably one of the best parts. I've had clients fall asleep before in that process, even though some of the little shoulder shrugs and movements we were doing aren't necessarily the most comfortable things, but people find them relaxing. So I look forward to seeing you on the next appointment, and I hope you have a wonderful day.